Hey everybody, what's going on? This is Mike of the Ozonaut, and this week we did a interview with Dr. Mandy LaGreca. Dr. LaGreca has been somebody that always fascinates me because she's just so driven, she's so passionate, and she's very research-based. So in her use with ozone, she's using it to heal interstitial cystitis as well as a whole range of things that are to do with gut issues. So she's a certified nutrition specialist, but she has she's just done so much schooling, so much education, and she really understands how to look at things holistically with nutrition and ozone. So take a look at this interview. I've been really excited about this because you are super busy and awesome. You're always doing like new and exciting stuff. And
Thanks.
just, I think when we first had a conversation, you're like, hey, correct me if I'm wrong, but I'm healing interstitial cystitis with ozone. And so that really interested me because there's not a whole lot of people that are doing that. And I like the specificity that you bring to all the different things you're working on. I was wondering if you could just tell people, because you just told me before this, just all the different things you're working on, all the different facets. But who is Mandy LaGreca and what are you working on?
So my name is Dr. Mandy LaGreca. I'm a doctor in clinical nutrition and I'm a certified nutrition specialist. I'm a certified clinical nutritionist, a functional diagnostic nutrition practitioner, and a personal trainer and fitness instructor as well. So I have a very diverse background in the health field. My career started, if I say career, it was when I was in raising babies. When they were babies, I got my fitness certification and I started teaching fitness classes for fun. Prior to that, I was an engineer for 5 years. Actually, you probably don't know this, Micah, but I was a packaging engineer. Yeah, I have an engineering degree. 5 years working in food industry, which was kind of interesting for me to see that side of things and how the food industry markets to people with their junk food. And at that time, I was very weight conscious, very conscious about nutrition because I wanted to manage my weight. So I was more interested in weight management. I always struggled with my weight my whole life since I was 12. And never understood why was it that my friends could sit there and pound down a pizza, but if I ate a slice, I blew up. Didn't understand why. So I became interested in from that perspective for my own selfish needs and vanity. And then I started to teach fitness, which was remarkable for me because it changed my body composition. Exercise did that for a while, and then became a full-time teacher, and then quit and decided I was going to go back and pursue my dream of nutrition once and for all. And so I enrolled myself in a doctorate and got all these certifications and finished with the pinnacle of my career with the CNS, which was the hardest thing I've ever done.
Yeah, I know. You were telling me all about that, and just like the amount of exams and the amount of work that goes into that is ridiculous.
Yeah.
It's not, because you think of like a CNS, the certified nutrition specialist, you would think like, oh, that sounds like a summer program or something,
No.
just with the way, but it is crazy. I mean, you're a doctor and it's just so much work to be able to do that kind of stuff. So that's really impressive, especially with your background on just all the different things that you've been working on. So can you dive a little bit into what a CNS actually is? What is it that you do? How do you work with people and all that kind of stuff?
So a certified nutrition specialist is really a clinical nutritionist. So a clinical nutritionist really utilizes biochemistry and your biochemistry to identify imbalances, then to uncover almost like a root cause and using nutritional therapies to reverse and regain homeostasis. That's really the big thing. CNSs call themselves, and actually let me hop in here and I'm going to share a screen here for you guys to see. So just so you understand first about what our organization, we are under the American Nutrition Association. And they adopted us very, just recently. And they've been around much longer than the BCNS has, the Board Certification for Nutrition Specialists. They adopted us, and now the ANA consists of these other organizations, and it's a growing organization for that. It hasn't been around for very long, but like 1993 is when the Board Certification for Nutrition Specialists launched. So this one here, which I'm under, they launched in 1993. So not been around very long, whereas ANA was actually around since 1959. So they decided to adopt us.
So can you explain, like, because I think people in their minds tend to simplify nutrition. Like for me, I'm like, if I just always go back to a keto diet, that's going to be the best. Like, what is it that you really bring to the table for people that's like, man, this is just so valuable. You just can't pass it up.
personalized nutrition really is what it boils down to. We don't believe in cookie cutter programs. Anyone can get a book off the shelf and say, I'm going to try this diet, but is that diet right for you? So we are cutting edge science that uses science and professional education training, peer reviewed, and then lab work. So actually with looking at some blood work or hair or urine, identifying imbalances. And from that, you craft a diet that's tailored just for you. And even genetics, even genetics. So even genetics is involved. It's called nutrigenomics, which is very strong in this field. So personalized nutrition, in a summary, is tailored for you, just you. So your diet isn't going to be the diet for your wife, your kids, or for your friends. It's yours. It's based on your health history, your goals, your lab tests, and also some genetic tests as well. It's nutrition based on your unique biology, not the broad keto fad, that you just said people do. And I'll give you a great example. When I tried the Atkins diet back in college, I felt horrible. I lost so much muscle tone. And everyone was doing it, but for me, it wasn't the right diet, yet I still tried it. And it was very damaging for my metabolism. And I blew up after I went off the Atkins diet. I tried a bodybuilder diet because I worked in fitness and everyone was on the bodybuilder diet. And so I tried that. And the results that they were getting wasn't equivalent to my results. And I always questioned, well, what's the problem? I'm not cheating. Why is this person getting ripped on this diet? But here I am struggling even to maintain my energy levels during my workout. So that's when my eyes really started to open that, maybe we are different, uniquely different through our biochemistry, and maybe there's something more to this. And so that's when I dove into some of this training, and I learned biochemistry was eye-opening for me. When I took the courses in biochemistry, it was all made sense to me. And I learned that based off of my unique biochemistry and my genetics, I needed to be more on a vegetarian type of diet, not vegan. I do need protein, but for me personally, my unique biochemistry, it does very well and functions very well with more vegetables and fruits than meat. Too much meat makes me sick. So now it all makes sense.
Is this like something that you can, like, you could take my blood, my hair, whatever, and take a peek at and be like, yep, Micah, you can't eat this, that, and the other? Or is it kind of you have to do milestone testing? So you test me now, then we try something, you test me again. What does that process look like? And also, how micro does it get? Are you going to be telling me like how many oranges to eat in a day, or exactly? Yeah, I'm just kind of curious.
No. So we teach you to listen to your body, because a lot of that, your body tells you when something's working for you. So it's more on the macro level. As far as nutrients that you need to support yourself and your physiology can be extrapolated through labs. So for example, you can find out if you have deficiencies, and you might need to support your diet through whole foods primarily, but we also do supplements, because I'm gonna be honest with you, Micah, our food quality isn't very good. By the time the food gets on your plate, it's lost 50% of its nutrient density. And by the way, the soil that it's farmed on isn't good quality like it once was. It's missing a lot of minerals. So we do supplementation as well to regain that homeostasis and that balance, but everyone's different on what they need. I have people who might need some more B6, some people might need more B1, some people might need more of magnesium, might need, sodium and potassium. So it's hair, urine, micronutrient testing can kind of give me that insight. And as far as like your own metabolic pattern for how you, what kind of foods you eat, your blood type, for example, your blood type, if you're A or B or O, will kind of give you insight on if you're more meat-based or more vegetarian-based. So like I'm blood type A positive, and as a result of being A positive, I am more geared towards a more vegetarian diet versus somebody who's more meat-based. And I don't remember off the top of my head which one would be the keto meat diet. Yeah.
Yeah. And I want to jump into interstitial cystitis in just a second here, but if somebody wants to, get on this program, say they have inflammation or just want to be better, or, for me, it might be like, hey, I want to optimize myself and make sure that I'm going to live a good life health-wise. Like, how do we get set up with this kind of program?
Well, we would come in and do a initial consult, and that would involve finding out what your goals are. Just a one-on-one consult. What are your goals? What are you trying to obtain? Is that something I can do? Because if somebody comes in and says, I want to grow 2-3 inches, I'm going to say, sorry, I'm not the right person for you. So that has to be realistic. So we use SMART goals. Like I have people set up SMART goals.
Yep.
What are your goals? Are they smart? Is this something we can do in the time frame that we're going to do it? Is this something that's even realistic? And then based on that, I give them options Well, these are some lab tests that you can probably do that could be helpful in identifying imbalances that you have right now. So someone like yourself who doesn't have any health problems might want more of a, I want to know if I am susceptible to developing any diseases in the next 20 years, right?
Mm-hmm. Yeah.
Something like that. So we could run like a, blood work, you can do and then you can do maybe a genetics test, like nutrigenomics somewhere. And that one would be able to give you your predispositions, like what are your genetic weaknesses, like your tendencies? Do you have pro-inflammatory genes? Do you have genes that's going to make you susceptible to free radicals? Do you have genes that are going to make you prone to, gut issues or mineral imbalances? And that's really good information, because even though you're not sick now, you could develop something in the future. I'll give you a great example. My own fiance, Terry, has arrhythmia that runs in his family. His entire family has AFib. And just this week, he had his first flare up. This whole time, he has been able to evade AFib because of his lifestyle, I guess. Even though his whole family had gotten it in their 30s, he thought he escaped it. And I was like, no, you didn't escape it. Your family has it. You probably have it. You just didn't turn it on yet. And he must have he's had a lot of stress lately. And on top of it, he was eating some things that were very inflammatory. And boom, his AFib started for the first time. Man. And that's the kind of stuff that can happen if you're not aware of what tendencies that you have from family history, but also from your own personal, looking at the labs and finding out where some of your imbalances. You can have imbalances and have no symptoms.
Right. Yeah.
You could be a walking train wreck right now and have tons of imbalances, but feel fine. That's over. If people always are like, well, my IC started overnight. And I'm like, no, it didn't. It was over the last 10 years that your IC was starting. You just didn't have symptoms.
Yeah. Well, I'm sold. I actually probably should book an appointment with you so that I can get some of that stuff figured out. I think it would be really interesting and it'd be a lot of fun and super valuable. But I think people watching might be interested too. So what's like a website they can go to? How can they contact you?
So currently my website is ichealer.com, which is for the bladder plane syndrome, but I'm working on one called root cause investigation. I bought the domain and I'm going to be working on that. So down the road, maybe in like another few months, you can check back. I'm going to have that one up, and anyone who has any health condition can now work through there. So in the meantime, go to IC Healer. And if you have other conditions that's not bladder related, come talk to me and we'll talk about that, something we can do.
Sure. Well, Let's talk about IC. What is it?
Sure. All right. So let's dive into this. This is super important. Or people are like, well, what's IC? Well, I'll tell you what it is.
First of all, how many people even have this in the country? Any idea?
Millions.
Millions?
Yeah, millions.
Wow, that's crazy.
Men, women, and children.
Yeah,
it's growing. It's actually something we're seeing more and more of, and younger people. My youngest client was probably 19, but I do read on the Facebook pages that children are getting it too.
Huh, that's wild.
It's really, really scary.
Yeah, I know it's not a good thing, but I'm interested to hear more about it.
So here is the traditional definition of IC. Idiopathic. Have you heard that word before? It means.
Can you tell us what it means?
It means no known cause. So when the medical community doesn't know or hasn't found, based off of their research, that there's that cause, they call it idiopathic. So that's why I list it as idiopathic, even though I do believe there's a root cause, and I have my 8 root causes of IC. But this is the medical definition. It's an umbrella term of many symptoms. It's historically considered non-infective, although now we're realizing there's definitely an infective component of it. And they're starting to, the new diagnostic measures of finding, different problems, such as DNA testing of the urine to identify the different bacterial species in the microbiome of the bladder, for example, is challenging this belief. So this belief is now being challenged. Okay, so here's your picture of IC, and here is your picture of a normal bladder. Now, I have to clarify something.
What are the symptoms? I still feel like I'm not quite understanding IC very well. Like
burning.
How do I know I have it?
Sure. Frequent burning, either in the bladder pelvic region or upon urinating, which was me. I was mostly during urination. Pressure in the pelvic region. Or like you feel pressure when you urinate, like you have to push the urine out and it's not fully emptying. Urgency and frequency, like you got to run to the bathroom. And you have accidents. I've had many of those when you don't make it in time. is pretty embarrassing. Retention, pelvic pain, pain upon urination, painful intercourse, which is where it damaged my first marriage, and nocturia, so going to the bathroom more often at night. So those are the main symptoms of IC, although there are other things that cross in, like vulvodynia, which is pain around the vulva. So there's just other things that people have, but primarily these are the main symptoms. And this is your bladder's anatomy, right? So just FYI, the epithelial tissue is a huge component of the pathology. So there's definitely some disruptions in the barrier, just like the gut. In fact, the barrier of the bladder is almost identical to the gut. The only difference is there's receptors on the bladder that tell you got to urinate. Your gut doesn't have that. But if you look at it from an anatomy perspective, the epithelia of the bladder is almost identical to the gut, which is what brought me into the gut as part of my, it's just a gut issue, really. That's where a lot of my research was around.
Okay, so you're saying like there's a bigger thing than just looking at the bladder.
Correct.
Yeah.
Yeah. So
you're making, not to get too personal, but you're making me think if I have IC, because I'm kind of just joking, because like my wife always makes fun. I'm drinking so much coffee, so much water, but my wife makes fun of me because I always go to the bathroom when we're doing like road trips or something. But yeah, probably too much for. Maybe
switch to decaf, because caffeine can actually stress your adrenal glands too.
Oh, I know. I need to.
What kind of coffee are you drinking?
I don't know what it is today. It's usually like one of those ones that has mushrooms mixed into it, like the normal kind, not the weird ones, but you know, like chaga and lime,
chaga.
That kind of stuff. Gotcha.
Yeah, try to stick to the things that are known to not have the mycotoxins, because that's one thing I found out about coffee is has mold. So you want to stick to brands that have been mold free.
Right. A bit, man, I don't want to get too off subject. That's a whole other conversation I have questions about, but yeah, let's jump back into what you were saying.
Yeah, so let's go back. So now that you kind of have an idea of this is where some of the causes are now from my perspective. Oh, let me just talk about one thing here. IC is now changing its definition and pulling away from bladder pain syndrome, which is why you have to understand now what's going on. In Europe, they now call IC only people who have Hunner's ulcers, which is actually caused by a virus now. So this is definitely, we know this now, a virus, polyoma B, I think it is, or polyoma A. If there's a viral component of true IC, that's not what I have. I have bladder pain syndrome. I actually have urethritis. I have urethritis, but when it's really bad, it affects my bladder. So majority of my condition is on my urethra, but there's people who have urethritis, they have bladder pain. And then if they have the virus, that's IC. So the definition's changing, and only about 5 to 10% of people with bladder pain syndrome actually have the viral component of IC. But that brings me into how ozone can be helpful, but we'll talk about that later.
So is this definition changing a bad thing or a good? Okay.
It's a good thing, because now you can change. Oops, did I? Yeah. Now you can. The therapies now can be changed, because if someone has the viral component, they might need surgery to remove the damaged lesions, because otherwise you got to remove the virus. It's almost like when you have breast cancer, you have to remove the tissue that the cancer was infected.
Okay.
That's kind of how, when it's really progressed, IC's progressed, the surgery is really helpful. And I think ozone, I truly believe it. I haven't seen it personally with those type of people, but I do think ozone could be useful for that too. But the bladder pain syndrome doesn't have, in fact, a lot of people who do a cystoscopy, see that image right here, the cystoscopy, a lot of people who do the cystoscopy with bladder pain syndrome, their bladder is totally normal. Mm-hmm. So that's where, you start wondering, well, what's going on here? Yeah. So anyway, so some of the causes that I found were things like pathogens, histamine intolerance, autonomic dysfunction, autoimmunity, anti-proliferative factor, endotoxemia, pelvic floor dysfunction, and hormones. So that's just a variety of different things that we're seeing that can be, I don't even want to call them causes, contributors, associations. So people who have IC have these other things as well. And we don't know if it's cause or effect really, but we know that they go side by side with people of IC. I see a lot of thyroid dysfunction, a lot of thyroid, autoimmune thyroid, like 50% of the people I work with have some type of autoimmune thing. So.
Yeah. Well, that's one thing I appreciate about holistic medicine. It's not saying like, oh, this is the one thing, because you were just saying like, this is correlative. So we're not sure if it causes it or if it's just running alongside it. But I mean, holistic medicine and what you're doing is kind of like, how do we look at all the different factors that are affecting your biochemistry and how your body's performing? So
Exactly. I love that. You know, and that was what opened my eyes is when I went to acupuncture for the first time. And for the first time, music to my ears was when he said to me, the body's a closed system. And I'm like, I always thought it was, but these doctors, they keep isolating my bladder from the other organs. He's like, no, if you have a bladder problem, it's coming from somewhere else. You know, in Chinese medicine, they always go to like the liver and the kidney. And so they're very, you know, it's a very interesting approach on how they address imbalances in the body. So, but anyway, so that brings me to leaky gut, which seems to be a really, really important correlation to bladder pain syndrome. And so I termed it leaky gut, leaky bladder, because like I said, the epithelia of the gut is very similar to the bladder anatomically. And so if the gut can get leaky, as you can see on this picture on the right, when the epithelial cells have openings between them. That's why it's called leaky, right? Because there's junctions. The tight junctions are no longer tight. You really want these tight junctions to be on the left. But what happens in leaky gut syndrome is they become like this to the right. And so these like chemicals can get in and cause a lot of problems like inflammation, autoimmunity, and then there's a chronic infection component, which brings me to ozone being helpful. But anyway, so this is where I kind of started seeing, wow, all these people have leaky gut syndrome, all of them.
Would I be correct in saying leaky gut syndrome, to oversimplify it, is poop getting into your blood?
Say that again?
Would I be correct in oversimplifying leaky gut syndrome by saying poop is getting into your blood?
So not necessarily poop, because that's in your rectal area, but more likely the molecules. So look over here. These molecules up here, proteins, antibiotics, infections, chemicals, like these tight junctions are supposed to keep these things out. But here's another thing. You see these little cells and these little hair-like things on the top?
Yeah.
They're supposed to allow the nutrients in, and these junctions are supposed to allow these big molecules out. But when you have leaky gut syndrome, you also have impaired little hair-like things up here. And so you don't get the right assimilation of nutrients, but then you get these molecules that are coming in and really irritating your immune system. Really what it's basically like saying is this is a gate, it's keeping out your enemy, but now the gate's open and all these enemies are coming in, and now your immune system's like, oh my God, I have to work so hard. These things are not supposed to be here right now. And so you get like this overactive immune system, which is creating such inflammation in the body.
Yeah, it's not a fun thing at all. My wife actually had, I wouldn't say she doesn't have it, but she used to have extremely severe symptoms from eating certain types of food. Like, for example, she would eat a pizza, and then the next day she would be puking until like 11 a.m. And it was like, why did you?
That's my daughter.
She's like, well, it's really good.
That's my daughter. Yeah.
She went through her first pregnancy. She did really good in terms of diet, ate super clean. And then she was using a number of supplements, and those actually severe symptoms went away. I don't know, that was like 6 years ago now. So she's doing really well, but yeah, I mean, it can really wreak havoc on your day-to-day life.
It's important to know what your food intolerances are. So we do food sensitivity testing too. I failed to mention that as well. We do food sensitivity testing to help identify what your personal triggers are. So with Terry, when he had his first episode where he realized dairy was an issue for him, he actually had back pain and he thought it was working out. And I'm like, you haven't worked out in 3 months. How could that be? So then he's, yeah, threw him under the bus with that one. But I was like, I doubt that's what's going on. So it got worse to the point where he had muscle stim on his back every single day. And I said, Terry, the muscle stim is not designed to be used all day long. There's something wrong here. Eventually, he got to the point where he was bedridden and he literally like fell down in the shower. I was like, okay, we're running a food sensitivity test on you. And I did. And I found out that dairy was off the charts. And he was a longtime milk drinker, like drinking glasses of milk, 3 or 4 a day, like straight milk. And so we pulled that out of his diet and his back pain went away. It was almost remarkable. Well, what triggered him with the AFib was actually dairy again. Yeah. So you go to see like now it's not back pain. Now it's your heart. Like that's serious.
Right. You can be consuming poison and not even know it.
Well, the thing is, he's not symptomatic with the heart. And so we only investigated it because he had the bagel and the cream cheese, and he was saying he's having chest pain. And when I hear chest pain, I'm like, we're checking your blood pressure. So I immediately checked his blood pressure. It was like 170 over 100. It was really high. And then we just kept checking it, and we called his dad, who has AFib, and we did some at-home tests, and we said, it looks like it's AFib. And it was triggered by just an inflammatory response to foods that he's not really supposed to be eating. And it was bagel and cream cheese. And so he's like, I'm never touching that again. So, I mean, this stuff is real.
Yeah, for sure.
And it's serious.
I mean, yeah. And you just wouldn't think like, oh, eating cream cheese is going to do that kind of stuff to you. But no, it's super important to know and understand. And I think too, once you get into a state that you're just used to not feeling well, like for instance, like if he might have just been drinking the milk all along, but that's just kind of his normal, you kind of forget what it feels like to feel really, really good.
You do.
So you're not even realizing, oh, like this is making me not feel good. It's just your normal. So it's just kind of hard to break out of that cycle until you're like, I need to do a nutritionist, or I need to do a total elimination diet or something.
Oh, yeah.
Not really going to recognize some of that stuff.
And listen, there's even foods that you think would be safe that ends up not being. I have an example where I was doing gluten-free bagels because I got on a kick, but I was like, oh, they're gluten-free. No, they had grains in them that were cross-reacting. I did it for about a week, and in the week in, I started noticing arthritis, and I have no aches and pains in my body right now. So for me to start noticing joint pain in my hands, that was something that kind of stopped me for a minute. I'm like, what? And I was noticing like heat in my knuckles, and I removed the first new food, which was the bagels, and within 2 days it was gone. So I knew that I was reacting to the bagels.
Uh-oh, I think my camera went out.
Oh.
Let me throw another battery in.
Sure.
Yeah, that's wild.
So let me continue on while you're doing that with these next slides so that we can just keep moving forward. So the conventional treatments of IC are kind of sad. They're Elmeron, which by the way is now being sued, class action lawsuit, because it's causing severe damage to the eyes. So a lot of people are suing because of the medication having done that to them. I never went on Elmeron because I felt when they told me my hair would fall out, and you see my hair, I'm like, sorry, I'll live in pain and have really pretty hair instead of going on Elmeron. So that was a big no-no for me. And I did know people who took Elmeron and they started balding. So that was like, no. Antidepressants, bladder installations, hydrodistension when they go up and they blow up your bladder with water. And some people find relief from that for a few months, but then the symptoms return. Pelvic floor therapy, which doesn't help most people, it didn't help me. Antihistamines, okay, that might help if you have a histamine component to your IC, and then taking immunotherapy and immune suppressants. So those are the conventional treatments right now that are offered to you. So when you go to your 7-minute doctor's office visit, and I'm sorry to say that, but it is a 7-minute visit. I have friends that are doctors, and they literally tell me I spend 7 minutes with my patients. Okay, are you proud of that? So when you go to your 7-minute doctor's visit, you're going to be offered one of these things for your bladder pain syndrome. Okay, but what they fail to know is that there are 8 known root causes of IC and bladder pain syndrome that I have identified through working with people in the last few years. And so these are the 8, and they're, it's kind of like a diagram I made, but like we've got inflammation and all these causes of inflammation, gut issues, SIBO is big, dysbiosis, leaky gut, trauma. That is a really important thing that people need to know, that the trauma component of this is very significant, where I talked to so many people that had either family trauma or sexual trauma or abuse or some sort in their family.
Wow.
So very, very interesting finding. Infections, genetics, toxins, food intolerances, and a variety of nutrient deficiencies. In fact, I put a course together. Hasn't been a bestseller. I think I put way too much information in this course to the point where people can't finish the content of it. It's like 9 hours long, and I didn't sell too many of them because people who bought it, they just didn't finish it. And I think it's because I gave them too much information. But that's just who I am. I give them everything, but I think I need to trim that down. And so finally, integrative therapies for IC include elimination diet, like you said, working on reducing the inflammation in the body, which is key for all diseases of mankind, is always inflammatory based. Optimizing your immune system, making your immune system stronger, rebuilding the gut lining, exercise, stress reduction, physical therapy and also hydration. And then, of course, ozone therapy is that extra component that I'm starting to really put my eyes on. There's just a population of people that really need to incorporate that into their healing regimen. And I was one of those people.
Yeah, I know you've been using it for a couple of years now. So how
I
does
totally
ozone, well, first of all, how many like actual intervention kind of therapies like ozone do you use?
right now it's the only one. I don't have anything that
Really? That's surprising.
why fat? What do you mean? When you say interventional therapies, you mean outside of nutrition?
Yeah, something that's like actually using like not a supplement, not food, but something
Oh,
that would be considered like a treatment or a therapy.
okay. FSM. I also use FSM, frequency specific microcurrent. I bought a machine.
What's that look like?
It looks like a STEM unit, really, but it's not.
Okay.
It's actually putting microcurrents into your body to reset your mitochondria and improve your mitochondrial response to optimize your body's own innate healing ability. You can actually target certain organs and certain diseases. And I'm not certified to do that. I was working with a PT who pre-programmed my machine. It's more of a systemic. It's not like you're putting a stim and you're working on the external nerves. It's systemically changing your physiology. So I've done that. I did that for a
And that's
year.
like putting pads like on your stomach or wherever, and then programming
Correct.
currents into it, right?
Correct. Now you can also do water. In fact, they recommend wet towels because it uses water. But if you don't want to do that because it's inconvenient, you can use the pads. So I've done that. My mom has seen a lot of success with that machine. She borrows it from me for her knees. So it does significantly reduce pain in the body. It improves your pain tolerance. Improves your ability. Because a lot of people with chronic illnesses, they're hypersensitive to pain. So this helps dampen that.
Huh. That's interesting.
So try things. So ozone, that I fast, water fasting.
Fasting's good. I like it.
3 to 5 days.
You do 3 to 5 days? How often do you do that?
3 to 4 times a year.
Okay. That's a decent amount. I think I've only done 3 days in the last year, or maybe it was 4 days, something like that. But yeah.
It's an event for me. I prepped for it. I'm like, the whole family knows it's happening. So I'm like, okay, we're not going to cook in here. I go get massages. I go get acupuncture. It's a healing 3 to 5 days for me. I haven't been doing 5 days as much. I've been kind of sticking to 3 because it's working for me, but I think I'm ready for 5. I just feel like, and honestly, it's because diabetes runs in my family. So I want to avoid developing diabetes too. So it helps with blood sugar.
Right. Yeah. There's a ton of helpful things. So circling back on ozone, how is it like specifically working with the IC? And I mean, I know this is just one element, so we can't just say like, hey, the ozone is the thing that's doing the job. You have a whole program. You showed us like the 8 different conditions, and I'm sure that gets really complex because there's probably multiple causes. But how are you kind of using the ozone in your regime and your way of doing things?
Right now, because I haven't been to my clinic to actually do the IV ozone, the major autohemotherapy, I've been using it at home locally. So I do rectal insufflation, especially when I feel like I've eaten something that's caused imbalances in my gut, like ham. So ham is actually known to cause UTIs. In fact, ham and chicken and turkey are the top 3 foods that also have a component of bacteria in it that can actually lead to dysbiosis and UTIs. I don't know if you knew that.
Yeah,
So,
no.
and and ham is like one of the top ones, but I love ham. So every once in a while I get lazy and I'm like, because I normally boil my ham, but maybe I didn't boil it, or maybe I had a cold cut, and I'll start feeling my guts like, oh no, I did it again. And so I immediately will do a rectal insufflation, and it seems to kind of calm things down in my gut. So I have that, and it's easy to do because it's right here in my house. Just go ahead, pop it in. It's easy. And honestly, I've still been using it for UTIs because one thing I failed to mention was because I had IC for 10 years and no one ever caught it. So I had all that bacteria and the biofilms in my urethra. I have scar tissue there.
Wow.
And so I have this like little bit of scar tissue that it makes me more susceptible to urinary tract infections because it's just my urine doesn't flow out as regularly as normally. And so when I feel the early signs of a UTI, I immediately do ozone. And I've tried different gamma strengths. If I have a UTI and I'm treating with an antibiotic, I will do ozone with it, definitely. And if I feel one coming on after intercourse, I'm like, oh no, I think we introduced bacteria again. I'll hurry up and do ozone. And I've actually been able to prevent getting one.
That's awesome. Yeah, I've heard that quite a bit, that ozone is for people that have chronic UTIs, that it can actually be a great preventative.
Mhm.
I don't know if there's any good studies on that, but that is kind of like a repeat thing that I hear over and over.
I found some studies on ozone insufflations in the urinary area and the bladder for IC.
Okay.
Yeah, some very positive studies that's shown that it actually can treat IC. It's because IC has that infective component, what I said with the biofilms, but I think it heals the tissue too. So I haven't tried yet to use a higher strength of the ozone on a regular basis to see if it would heal my scar tissue. But I did find a journal, and I'm going to share with you later, that talks about ozone for healing the actual tissue. They use it in a lot of dental treatments
Right.
for actually healing like damaged gums using ozone, but I haven't actually done that where I did it every single day at a higher strength. Because I'll be honest with you, the higher strengths can get a little bit uncomfortable when you
Oh,
go
for sure. Yeah, especially
60
in sensitive
gamma.
areas. Hmm.
So I found the 39 gamma is like my sweet spot. If I go higher, especially when I have an actual UTI, there's a little bit of discomfort, but it does work.
Yeah, yeah, and I think it kind of ranges for people, just as far as the discomfort, if there is any. I mean, typically, I don't think there is, but yeah, and it's common. The ozone is actually used quite often in just scar tissue, like on the skin. So if somebody had their appendix removed and they have scar tissue, sometimes they have referred pain that they're not aware it's from the scar.
Yeah.
So I've known a lot of practitioners that will work with scars to use the ozone to break them down, and they essentially just take a very tiny needle, go right below the surface of the scar, and just inject. They kind of microneedle up it and just try to break it down over time.
That could be, an option. It's just such an invasive area for me, and
Oh
I'm not
yeah.
enough with discomfort right now to go there. But I did think about if I wanted to take it to the next level, is there options using ozone, maybe stem cell? I don't know if you've ever heard of stem cells and ozone together. They seem like they would work really well together.
Yeah, so like the thing, right, ozone is an oxidant, right? So you don't really want to put like ozone in conjunction with stem cells because that's expensive. You don't want to deteriorate those or, reduce their effectiveness. So, this guy, what was it? It was a extensive medical Philip Thiede. He runs a stem cell lab, and he was talking about their use with ozone. And what they would do is, say they're doing a knee injection or even an IV, what they would do is like 2 to 3 weeks before, or even further if possible, they would start doing ozone therapies into that area. So if it's into the knee, they would inject the gas in there. If it's an IV, they're just doing a systemic treatment. And his idea was that creates a better platform for these stem cells to take place, because it's going to be doing some healing and going to be allowing those stem cells to get the best benefit. So that was his idea. And I've heard a number of them. I know of people that also chase it after they do a stem cell treatment, not right away, but like a day or a week later or something in that ballpark. But yeah.
That's interesting. Yeah, these are just things that cross my mind, but at least for the infection perspective, it's been very helpful for me. I have sent some people to use it at home. Clinic. I go to the clinic. For COVID, we were going, once a month. Actually, our clinic is 2 hours away, but I was doing the MAH. I loved that. That I just felt amazing after that. It's just, it was something. I mean, like the energy you get from that, and just, I can't explain it. The IV.
Yeah, right. Major autohemotherapy. Yeah, that's
Yeah.
when they, just for anybody watching, that's when they take some blood out, mix it with ozone, and put it back into your vein. But yeah, I think for a lot of people too, they generally get the best results if they've done at least 2 or 3. I don't know if you notice that. Maybe if you're in a really healthy condition, one will make a difference for you. And I've heard that sometimes, but a lot of the research, Dr. Velio Bacci actually discussed, like, you really, if you have some sort of disease or something going on, you need to do 8 treatments,
That's what I did.
preferably more. Yeah.
Yeah.
Yeah. So
I did.
somewhere.
I did more than that. I think I might have done 10. I was going quite a bit during those early days until I identified that the oxalates were causing my problem. Then I realized that, okay, as long as I'm eating a high oxalate diet, I'm not going to get the benefit that I need from all this. But that's a whole other part of the diet that I found out. But yeah, so again, it doesn't trump the lifestyle. So people listening is like, you can do all this ozone and all these extra treatments, but if your lifestyle is still promoting inflammation, it's only gonna, it's like throwing a rock in a large, small little stone in a large pond. So, it goes really well with the lifestyle component. And I found that for ozone, what's really interesting is it also goes after Enterococcus faecalis, which is
Can you?
one bacterial species that is very, very common overgrown in IC. It is
Okay.
overgrown in the gut. I've seen on GI tests and overgrown in the urine. That was my persistent infection, was Enterococcus. Mine was very pro-inflammatory. It's actually a commensal bacteria when it's in smaller amounts, but when this guy overgrows, he's angry and inflammatory. And so I'm finding so many people with IC have that in the group B strep. And ozone can go after that, which is important because it's the one that can become very drug resistant with the antibiotics. It's a very drug resistant strain. And that's what I was dealing with. I was dealing with some serious drug resistance where the antibiotics weren't working anymore. So that's why ozone came and helped me with that. And I think it works so good, even if you are taking antibiotic together, they're like powerful duos.
Yeah, I think it's a really confusing therapy in the sense that it's used for so many different things. Like, I think one thing well, I've been talking to some people about it lately, but they tend to get so skeptical about something that has like such a wide variety of uses and things like that, which I can kind of understand because when you go to a conference and you see something and they have a list of here's 300 things that it cures or like works for, kind of sounds like the same thing. So I think it's really important to understand that ozone is it's not the thing that's doing the work. What it's doing is it's causing a reaction in your body for your body to be enabled to take care of the disease, or basically causing homeostasis, like you said, like self-balancing. So ozone in a lot of cases is actually just helping your body to perform better. So it's not so much that ozone is doing all these things as it's causing a certain reaction that enables your body to work.
Gotcha.
Well,
Yeah.
and in the case of this, working with viruses and bacteria, it does have a direct action on those if you're exposing it to that. But
well, that's what I'm wondering, and it'd be a great little follow up is the people who have the hunters and the IC with the hunters, that IC one, those 5 to 10%, would ozone be something that would help rather than the surgery? I'm just curious because I know a lot of them are getting the surgery, but knowing that ozone is antiviral, I don't think we have enough people who have it who've actually tried it, because that's not something that doctors would recommend unless you're in Europe. Am I correct?
Well, in Europe, it's recommended under certain indications, and there's the Madrid Declaration, which has, I think, levels A, B, C, and D of like, hey, A has the most research. This is like 100% of the time. If they have this indication, you should prescribe it. And then B, C, and D. So they kind of have the different things outlined in that document. Have you gone through that, the Madrid Declaration?
No, but I'd love to see that.
Yeah, I'll send it over. So what it is it's a document that was put together by the International Scientific Committee of Ozone Therapy, and they try to compile they're trying to organize ozone therapy so that it can become approved in more countries. So they compiled a ton of research. They got together basically all the scientists, all the top people that are working with it, and said, hey, here's a document. What do we agree on? So this was signed by, I don't know, maybe 40 of the top professionals based on who they think is the top professional or who's, volunteering. But anyway, it's a document that these 40 professionals agree on that, yes, these are the things that ozone therapy is good for. This is how it should be used. This is how it should be implemented. So it's really kind of the foundational work for ozone therapy to just grow in popularity across the world.
So maybe like a gold standard too.
Yeah, that's the focus, that's the goal, so that when a country, because I think back in 2012, there was like 7 countries in Europe that approved it, and now there's over 20, and quite a few more that are on deck to do that. So this document is really helpful for when they're making legislation, when they're trying to understand it more, because they're kind of laying all the things out there. And they have a number of different documents, but they're standardizing everything.
Interesting. Yeah. I always send people to Dr. Schallenberger's book, The Ozone Miracle, or Miracles of Ozone, whatever the title of the book is. I always send people to read that first to educate themselves. I also send our YouTube video that we did together last year, because I have people do ask me a lot. And I think that initially they want to find a clinic. That's what I did. I did it at a clinic first. wanted to make sure it was right for me. I wanted to learn how to actually apply it myself, because it's an art. You have to know that you're doing it correctly. And then once I knew it was the right thing for me, I bought, a machine, and then here I was, self-administering with a catheter, which I know sounds crazy, but hey, I always tell people, there's people who are administering insulin to themselves. There's people who are getting dialysis. This is nothing. Because sometimes people are like, oh my God, I can't believe you're doing that. I'm like, why? It's not that big of a deal. It's like getting a dental treatment. Like, it's not a big deal. You just have to get over that initial hump of, I can't believe you're doing that. Like, what helps me? Why wouldn't you want to do it?
Yeah.
Yeah.
Awesome. Well, do we have anything else to go over? I mean, we touched a lot of awesome subjects there, so.
Well, can you tell, the listeners, like, how they would access, like, do you have like a database where they can access ozone providers, or like, how they get a machine or training on how to use it? Like, where would you direct people?
Oh, so I get to do a pitch. No, so we had a database and then it disappeared. Did you see that email out like in October or whatever?
Yeah.
So like, the people that were hosting our website, they're just like, yeah, it's gone. And I was like, what does that mean? Well, we don't really know. Essentially, all the data on our website, it wasn't deleted, but something happened to where it was like inaccessible. So
Yeah.
we did have a map where people could find ozone practitioners, but I actually found that Google is pretty good. So if you search ozone therapy near me, what Google does is it catalogs like everything that's on their website. So it can pretty reliably find practitioners that do ozone therapy. So that really is pretty good. And then I guess the one thing that I always tell people is we have a guide if you're interested in getting started with ozone therapy. So I don't know if you know about that. We have one for patients, and that's like a 9-page document. It walks through everything you need to know to get started. We also have one for clinicians. So if you want to implement it into your clinic, we actually have a more in-depth guide that's going to walk through everything that's required. It's intended to be kind of like a handbook that you can go back to, find your resources, or if you want to get started, it gives you kind of the next steps on what that looks like. So
yeah, I'll definitely take that guide and give it to people who've asked me questions about ozone.
Yeah. I think you just go to doctorzone.com/guide, which is DRS. Zone.com/guide. So that's what I'm always telling people about.
All right. Well, thank you. This was great. And thanks for having me today.
Yeah. Now you're doing the outro. You told me to do the pitch, then you're like, oh, thanks, Micah. Appreciate you joining me today. No, it's awesome. I've actually wanted, I don't know, we've been talking about doing this since like November or something, but just the work you're doing, I find really fascinating because you do very research driven things, and you're you have a high intensity and a lot of passion for this market or this industry. So that's really cool to see. And I appreciate
when you're struggling with your own health and you don't get the answers you need, you have to turn it into passion in order to get the results you want. So that's where it comes from.
Yeah. And then
and then he disappeared.
Whatever. All right. We'll finish it off with this.
Okay.
This is my crappy camera for everybody.
It's all good.
Yeah. Thank you so much, Mandy.
Thank you. We'll talk again. Thanks.
Yeah. Sounds good.
All right. Bye-bye.